Thank you, Dr. Fullerton. Our next speaker is also a family practitioner, Dr. Barry Dworkin. If you're a CFRA listener, you hear Barry every morning on CFRA. He also hosts Sunday House Calls, something he's been doing for more than 7 years now. And he also appears every Wednesday afternoon on CFRA taking phone calls from listeners with questions about healthcare. He's done a lot of writing about healthcare as well, including in the Ottawa Citizen. He's an assistant professor at the University of Ottawa in the departments of family medicine and maternity and child care. He also has a whole bunch of quirky pastimes, which are too many to mention right now, but they include building Lego robots, model ships, planes, trains, and he's also very much into computers and science fiction and history. And don't get him started talking about politics if you have a chance to speak to him, because unless you've got some time to listen to his opinions, because he has some very strong opinions about politics, which I'm always happy to hear. Please welcome Dr. Barry Dworkin.
Well, it warms my heart to see such a great turnout. I'd like to thank you all for coming on a nice summer July evening. And what I wanted to start with is I want to cover a bit of history of our family practice and how we've been able to improve the patient experience, access, and standard of care, and what the future holds. We took out business loans in 1992 and set up a practice just down the street at Meadowlands in Prince of Wales with 4 physicians, a secretary, and 1 nurse. And our commitment was and continues to be today to provide the best possible evidence-based family practice. And the cost of developing the infrastructure necessary to provide this care has been through business loans. Physician overhead payments contribute to covering the loans, and also just the overhead costs in day-to-day operations. Today, 20 years later, we have a practice of 10 family physicians, 3 nurses, a mental health nurse, 12 support staff, a chiropractor, athletic therapist, and massage therapist. Indeed, when we became a family health organization in 2010, our expansion at that time included establishing electronic medical health records, providing continuing medical education for physicians and our staff, increasing the number of our exam rooms from 7 to 16, fully equipping a surgical treatment room, expanding our waiting room area, purchasing over 40 workstations, 4 scanners, and other electrical equipment and networking infrastructure in the physical facility. We also increased the time that we were available to see our patients. That includes providing urgent care services from 9 a.m. to 8 p.m. every day during the week, from 10 a.m. to 1 p.m. Saturdays, Sundays, and holidays. And that's in addition to our regular appointments, same-day appointments, same-week appointments, and also other emergency services. Our practice plan this year was to recruit 2 more physicians, and with the overhead generated by their income, to hire either a nurse practitioner or a physician assistant to provide continuing care in situations where it really wasn't necessary for the family physician to be the first one that a person would see. This would then increase the number of patients that we'd see during the day, improving access to care. And through our electronic record system, their physician will be kept apprised of their care for the day. So let's say, for example, you have high blood pressure. So you'd see the nurses for your blood pressure anytime between 8 and 6 during the week. You wouldn't need an appointment. You could make an appointment if you wanted to, but you don't need to have an appointment. If your blood pressure was elevated, the nurse would send me a message through the electronic record, and any changes regarding medications or blood work to assess kidney functions or cardiovascular disease risk would be sent back to the nurse for any modification, any medications that would have to be changed. I'd send a message back. Then, patient goes home. Medication changes could be called into the pharmacy. For some of our elderly folks, it can be delivered straight to their house. They don't have to take a prescription, go to the pharmacy, and be inconvenienced that way. We provided further funding for our registered nurse in the area of diabetes care, sent her off to courses so that she could counsel our diabetes patients and monitor their follow-up, especially after blood tests that may indicate that they may have to have some tweaking in their management. There are also many aspects of family practice that involve screening and prevention. These include screening for colon and breast cancers, flu shots, childhood vaccinations, pap smears, all of which we monitor and mail out reminders to all our patients. We also provide an on-call service to telehealth, should we be called by a telehealth nurse, and can manage some of our patients also by telephone and email. When I come into my office every morning, on my desk there are at least 20 to 30 pharmacy prescription renewals, medical imaging and blood test results, consultant and pathology reports, insurance forms, and other form requests, among others. Each and every one of these is acted upon, given that I'm quite obsessive-compulsive about this, before I start seeing patients and a support staff that helps me manage each of the details. This is a brief and certainly not comprehensive example of what we do every day in our practice. Up until recently, we had finally reached the point where we were happy with the standard of care and the outlook being good with regards to continuing to make our practice a center of excellence. We created a web that connects the patient to comprehensive care. With the McGuinty government's proposed cuts to family practice by April 2013, all, and I emphasize, all of these aspects to family practice that I just illustrated to you will be severely limited. They are proposing initial cuts to our practice revenue of between 15 to 25% in 1 year. Patient care will suffer because we will have no choice but to cut staffing and nursing positions in order to have the practice survive. The interconnected web I just discussed of care and services collapses, and we are no longer able to practice a standard of care that we have been trained to do. And this is not an understatement. I've been managing my practice and following every dollar for the past 20 years. I know what it costs to run a family practice, and ours costs $1.2 million a year to operate. Physicians know what it takes to provide an excellent standard of care. The politicians believe that they can micromanage your healthcare system by cutting fees and telling you that you'll get the same standard of care. With all due respect to our elected representatives, this is not factual. I have a list that I have brought that highlight all the cuts in the government's proposals over the next 3 years. I can certainly get into more detail about this later, but suffice it to say that everything I have mentioned above will be gutted if they follow through on this. Given their behavior of unilateral implementation of the changes, I have no doubt that they will try their best to do so. And I found out this today. This is a response I got from our consulting service that helps us with the paperwork to register those new physicians that we wanted to get this year. Quote, this is directly from them. We have a number of physicians who have been impacted by the Ministry of Health's recent inability or unwillingness to process new applications. Locum applications and replacement physicians are being processed, but no new groups are being approved, and no net new family health organization physicians are being added to groups. When confronted as to what was causing the holdup, I was told that, quote, processing of applications has been and continues to be delayed while we conduct a review of policies and procedures related to registration of these groups and physicians. They were unwilling to provide a time frame for when the review will be completed. So our goal to register 2 more physicians is now on hold, as is the expansion of our staff. So what happened to the government's claim that they'll be adding 700 new physicians a year if they're now not registering any of these physicians? It is you that can pressure this government to reconsider, a government that expects us all to contribute to debt reductions, yet has now wasted, as of yesterday, $2 billion on e-health and over $1 billion on Orange. I have patients, some of whom I've known for 20 years. I've watched babies that I've delivered grow up and now delivering their babies. These patients are my family. It is difficult to witness what amounts to the destruction of family practice and to our extended family of patients' health care. You don't hurt my family. Your help to prevent this is crucial. Thank you.